All right. So we've worked our way from the cellular level of the muscular system, and now we're all the way up to the organ level. So we're going to be looking at how these skeletal muscles, remember this is only one of three different types of muscle, right? Skeletal muscle, cardiac muscle, smooth muscle. So we're mainly looking at skeletal muscle, and then we did some kind of comparisons between smooth and skeletal, and then later on in cardiovascular system we'll look at a more in-depth view of cardiac muscle. So now we're going to look at the skeletal muscle system overall and how it moves the skeleton, how the muscles are named, how they kind of physically are set up to move the skeleton, and also then talk about specific ones and their particular actions. So let us take a look at the variety of ways that we are moved. So again, mainly looking at skeletal muscle, looking at how this is going to bring about movement, also how the muscles are going to be named, because each name tends to give us a bit of a hint about what that muscle does or where it is or how it's shaped, etc. We're going to talk about that leverage as well. So it's kind of the physics of it. So remember that when we were learning about this whole sliding filament mechanism, when we stimulate the muscle, it contracts, right? So we have the sliding of those thick and thin filaments, right? The thin filaments are moving past the thick filaments, shortening the sarcomere, shortening the muscle cell, shortening the muscle itself. So we stimulate it and it contracts and shortens, and then when we stop stimulating it, it relaxes. So it's always going to pull. It's never going to push. We can produce actions of our body that are like pushing, but we're using different muscles and different muscle groups in order to do that, and each muscle is only ever pulling. Now when we're talking about these muscle groups, we're going to find that we're going to have ones that produce the action of interest, those that produce the opposite action as well. So they're often located on different sides of the joint, different sides of the limb, and so physically they're on opposite sides and they have opposite actions. So it's definitely a good example of our structure and function relationship. So when we look at these different muscles producing these particular actions, we have these functional groups. And like we said, we have this thing that's called an agonist, right? So an agonist is going to be your prime mover. It's going to, for whatever movement you're interested in, it's going to be producing that movement and primarily responsible for it. So then there's going to be an antagonist, and the antagonist is going to have the opposite movement. So remember, you're defining the movement. So if you're talking about flexing of the elbow joint or flexion of the head and neck, etc., that's the movement that you're interested in. So the agonists or the prime movers are going to produce that action, and the antagonists are going to have the opposite action. So it's kind of like if you are analyzing, like an English class, a story, you have your protagonist and your antagonist that work opposite to each other. So the other thing that we find is that we have these things that are called synergists. And the synergists, you talk about synergy and how you're supposed to be working together as a team, etc. The synergist will assist the prime mover in producing a particular movement. So it's not usually one cell that's one group of cells in one muscle that's responsible for a particular action. We usually have a bunch. Just like it's not usually one cell in one muscle that produces the contraction. Okay, so agonists, antagonists, synergists. We also have these ones that are called fixators as well that help to kind of not necessarily immobilize totally, but basically stabilizing, if you will, that joint for the particular action to occur. So again, it all depends on what particular action you're interested in as to what muscle will have what role. Now again, as we get into this tour of the different skeletal muscles around the body, remember there are some general rules. So if we can kind of look at these different compartments and see where the muscles are located on different types of sides of the joint, we can kind of rationalize and figure out what actions they may have. So for instance, muscles that are on the anterior side of most joints produce flexion. So remember that flexion is where we're going to be decreasing the angle. So if I'm doing something like flexion, again, of the head and neck, right, we're decreasing the angle here. Flexion of the elbow, we're decreasing the angle here. flexion of the wrist, we're decreasing the angle here. So generally those flexors are going to be on the anterior side. So the muscles here on the anterior side, muscles here on the anterior side, muscles here on the anterior side are going to produce flexion. Now, as always, we try to give you these guidelines. It's not a hard and fast rule. There are particular, if you will, exceptions to the rule. So if on the anterior side we get flexion, that means on the posterior side we generally get extension. Also, when we're talking about muscle groups and muscles that are on the medial or the lateral side, if it's on the lateral side, it's going to abduct. Remember, abducting, if we think about, unfortunately, a child being abducted, right? They're going away. So we're moving away from the midline. So the muscle has to be over there because remember, muscles only pull. They don't push. So we're not pushing that limb out. We're pulling on it from the lateral side. Likewise, if we're adducting, if we're bringing those limbs back to the main mass of the body, we're adding it back, then those are going to be more on the medial side of the joint instead. Okay, so that's kind of a guideline to help us kind of picture how these different muscles are going to act. And one of the things we said is that oftentimes the names of the muscles will give you hints about the different characteristics of that muscle, and some of the ways muscles are named are according to, for instance, muscle location. So as you've been going through in lab, you've been learning about muscles like the temporalis, which is over the temporal bone, right? So it tells you where it's located. There's also a frontalis muscle over here and occipitalis back down there. So muscle shape as well can be one that is indicated by the name. So for instance, a deltoid shape is kind of like a triangle. A rhombus, right, is going to be like a parallelogram. So we have a rhomboid muscle as well. So sometimes they'll tell you about muscle shape, muscle size. So you'll see this, right? You'll see maximus or major. You'll see minimus or minor. You may even see brevis or longus or something like that. So that means that it's big or small relative to another muscle. So we'll see kind of groups of muscles: pectoralis major, minor, gluteus maximus, medius, and minimus. They may not all be on the list of muscles you need to know, but that part of the name, like we said, major or maximus, tells you this is a relatively large muscle in comparison to some others that are near it. Okay, so it could have to do with the relative size, the direction of the muscle fibers. So for instance, rectus abdominis, the straight ones of the abdomen, transverse, like it's going to go across the transverse plane. Oblique is going to come at an angle. So a lot of our abdominal muscles have that part of their name: rectus abdominis, external and internal oblique, transverse abdominis, etc. Number of origins. So we see that. We see biceps femoris. We see biceps brachii, where it has two different origins to it. And then we have triceps brachii, right? Triceps brachii, which has three heads or three origins to it. Other ways that muscles can be named as well. Those are the main examples that we have for that. So if you will, there are some cases where you might find additional hints about the particular muscle, but think about those. Oftentimes we'll ask you questions like, name 3 ways that you can name skeletal muscles, or that skeletal muscles are named. Or it may be, give an example of muscles that are named according to their shape, something like that. Location of attachments too. So sternocleidomastoid is an excellent example of that, right? Attaches to the sternum, to the clavicle, and to the mastoid process. And then muscle action, right? So we talked about flexors and extensors, right? Adductors, things like that. They may well be in the name. Other aspects, physical aspects of the muscles, what we find is sometimes those fascicles, those groups of muscle fibers, are arranged in different ways. So those fascicle arrangement can sometimes then give you different structures for the muscle, and that can produce more action, a wider action, or more power, or something like that. So you can see there are different types of pennate muscles, right? Like feathers, you see them coming in from both sides or just one side. Or we can see multipennate, where you have a lot of connective tissue and a lot of fascicles that are arranged in different directions. You can also see how those fibers can be arranged in parallel with one another. That's very common. Fusiform is also very common, right, where it narrows down, if you will, to where the tendons are. Circular, orbicularis oculi, orbicularis oris, convergent. So there's one tendon and it's all converging on that one tendon, which is different from multipennate because we have connective tissues here within the muscle itself. So, like we said, depending on the fascicle arrangement, the length, etc., it can give the muscle its particular function, more power, more movement. If we're moving that insertion towards the origin and it's very long for parallel, we're going to get a lot of movement when it contracts. So lots of different ways that the structure, again, gives rise to the function. Also associated with the function, most of these muscles that we've been talking about, they're going to span a joint and they're going to produce a movement. We're going to be moving bones. And so we're going to have, when we talk about this, we usually have different structures of these movable systems. So we're going to have a load that we're going to be moving, whether it's the weight of the forearm or something like that, or you're actually lifting something. You're going to have a fulcrum, which is going to be the pivot point, and then you're going to have the power that's coming from the muscle itself. So like we said, there's also, with the lever, right, the bones are going to be our levers, just like a teeter-totter bone or something like that, right? These are going to be the levers. We're going to be attaching the muscles to them, and then when they contract, they're going to move about a particular joint, and that's the fulcrum. So lever, fulcrum, and effort or power, which is going to be moving, the last bit, which is called the load. And there's three different classes of lever. The lever systems, if you've ever used it for leverage, right? If you're talking about like a bottle opener or something like that, for soda only, or you're talking about a jack for your car or something like that to jack it up so you don't have to lift it by hand, right? Or you even just take a piece of wood and you put it underneath a rock or a shovel or something like that, right? That long lever, that long bar gives you leverage. So three different classes of our lever systems. This first class that we see here, we have the load on one end, we have the effort on the other end, and we have the fulcrum in the middle. So this is kind of like scissors, right? So we can see your hand, your muscles go here and here, and we produce the movement by the power of the muscles. Here's your fulcrum, your pivot point right in the middle, and your load or your action occurs on the other end. So this is similar to what we see here in terms of the movement around the head and neck. So sternocleidomastoid on the anterior side, and then we have some of also latissimus dorsi that's coming on to be able to extend the head. But we can see the pivot points like right in the center here. So whether we are nodding our head yes, or in terms of flexing the neck, or contracting the muscles on the posterior side in order to extend it again, we see that fulcrum right in the center. And the load is basically the head itself, the weight of the head. Second class lever, we see arrangement, right? The fulcrum's now at the end, the load is in the middle, and the effort is at the opposite end. So this is like a wheelbarrow. That's our pivot point right there. Our load is here in the wheelbarrow, and we're applying the effort there. So that's kind of tough, right? Because you have your load right in the center rather than on the opposite side, like the teeter-totter. But you still get some of that mechanical benefit of having that long lever system like we see there. And this is an example, like we think about the movement, the plantar flexion of the ankle. So again, we see our fulcrum on one end, we see the load in the middle, and we see our effort on the opposite end. Third class lever system, again, we're mixing around, fulcrum on the end, effort is now in the middle, load is at the opposite end. So this is kind of like tweezers, right? So here, you're applying the effort in the middle along here, and that produces an action down at the end, a wider action down at the end. So you gain some kind of mechanical advantage there. And that's kind of how a lot of our levers that we see here within the body, like biceps brachii, work as well. You've got your fulcrum, we see here in the middle. We got the load on one end, and here we have our effort. Now, to deal with the effort, notice even though the belly of the muscle is right here, remember with the third class lever, the effort is in the middle. So when we look at it, even though the muscle is right there, here's the attachment over here. So when we compare the location, we can see that our effort is right here in the middle and the fulcrum's on the end. Okay, so let's take a tour of our different muscles around the body. We're not going to name origin insertion for all of them, but we're going to take a tour and kind of highlight some of the general actions of them. So about 600 muscles or more, right? 3 times as many bone as we see in bones. And they're grouped, like we said, according to their actions. Their names vary. So we'll take a tour through. But what you'll notice is in the chapter, a lot of what you see in the chapter is a lot of tables and figures, references to help you learn these in terms of lab, if we're learning individual ones, etc. So in the lecture exam, we're not going to ask you origin, insertion, and action, but some of these kind of larger scale types of questions, like which muscle groups are working together. We might ask you a question, name one muscle or 2 muscles that move the shoulder or flex the arm or something like that, are antagonists to each other, so you know these relationships, things like that. But we're not going to ask you to ID them on the lecture exam. So we can see a number of our different muscles. Here's our temporalis, like we said, attached to the temporal bone. We see our masseter, our main one for chewing that we see here. So those are working together. See how the fibers are going in somewhat similar directions in order to close the jaw. We see our orbicularis oculi there, orbicularis oris going around the mouth. There's also deep inside of here, there's a buccinator that helps to compress the cheek. Now, always there's a variety of other muscles that we don't have to know, but this is just highlighting some of them. So there's that sternocleidomastoid that we mentioned. There's also the trapezius, which that's just one part of it. The rest of it goes way down below. So we'll take a look at those as we tour through. This is just showing some of the actions. Again, not all of these muscles are you going to have to learn, but orbicularis oris, these sphincter muscles, are going to, in this case, pucker the lips or close the eyes, blink, orbicularis oculi, like this. And again, cutting some of the superficial muscles away, we can see the attachment points for these different muscles and how they may produce a movement here, in this case at the jaw. But in the case of the buccinator that we see right here, it works to compress the cheek instead. And so when we compress the cheek, that's going to make, you do it when you whistle, but it also helps you to chew. Let's see if we can play that one. I got to remember. Play. Got to change my pointer. All very complicated.
The origins of buccinator are from the posterior alveolar margins of the maxilla and mandible, and from a band of connective tissue running vertically between the two, known as the pterygomandibular raphe. At its insertion, buccinator blends with fibers of the orbicularis oris. Buccinator compresses the cheeks to hold food between the teeth while chewing. It is innervated by the facial nerve.
So, there's a lot more detail than you have to know there, but these animations do a good job of showing you the actions of individual muscles sometimes, and that can be helpful. Okay, some of the other muscles. We have seen a digastric muscle. So we talked about, when we were talking about the masseter and the temporalis, how we can close the jaw, well, we need an antagonistic muscle to be able to open it. So when we're looking at that, right, we're seeing that is attaching here and closing the jaw, right? So we need something that attaches on the other side of that joint in order to open the jaw. And so we get that from the digastric muscle. And so the digastric muscle has 2 bellies. So there's one that is going along here, and there's another one that goes here and attaches here, right in the middle where we have this curve of the mandible. So because it has this pulley system, there's a loop of connective tissue right there off the hyoid bone. When it contracts, it actually is going to pull the jaw open instead. So again, our antagonistic action. So it's going to come along here, and it's going to pull the jaw open. And it's because it has this loop to it that we don't have to have an attachment point way down here. The loop sends it back towards the posterior like that. But the action is going to open up the jaw. All right. Other things we see, we move away from head and neck. We look at those of the torso. We're going to find that there are muscles that are there for ventilation. So ventilation is for breathing. That'll come more in Bio 202. But a couple sets of muscles. Inspiratory muscles. Inspiration is like inhalation. And then expiration, sounds bad, but it's exhalation. And these are, as you can imagine, antagonistic muscles. So we start out with the diaphragm, which is an umbrella-shaped muscle which separates the thoracic cavity from the abdominal. But there's also these muscles that are in between the ribs, right? So external intercostals, external is saying that they're more superficial, and then inter is between, costal is rib. So we have external and internal intercostals. So diaphragm and external intercostals for expanding the rib cage to allow the lungs to fill, and then external intercostals is going to bring it down like a curtain. Now, in fact, if we stop stimulating the diaphragm and the external intercostals, they'll naturally go back to their original position, which helps with exhalation as well. So here you can see, right, external intercostals. See how the fibers go one way like this? Internal intercostal are deep to them, and their fibers go the opposite direction. Opposite direction gives us the opposite action. And then, of course, down here, you can see how tasty they are as well. The next time you go to Tony Roba's, you can flip it this way and that and actually look and see internal intercostals and external intercostals. You got to lick that sauce off, though. Also, the diaphragm, we're looking at the inferior view of the umbrella-shaped diaphragm. So it separates the thoracic from the abdominal cavities, but there are tubes that have to get through there. So for instance, the vena cava has to get to the heart. We have the esophagus coming down to the stomach, and we have the aorta, which is transitioning from the thoracic aorta to become the abdominal aorta and feed blood down to the lower limb. This is a superior view, and again, you can see that umbrella shape of it, and you can see some of these major blood vessels and tubes cutting through. Okay, so chest down to the abdomen. We mentioned the abdominal ones already, right? The straight muscles, the rectus abdominis, the external and internal obliques that come in at angles. So when we look at it, and transverse abdominis as well, when we look at them, they're layered, but again, the fiber arrangement makes all the difference. So rectus abdominis are the straight ones that we see here. They're going to flex the vertebral column. External oblique is more superficial. Internal oblique we see here on the left side. I'm sorry, you have external obliques showing on both sides, but they did a cutaway on the patient's right side, so you can see the internal oblique, and you can see how those fibers go the opposite way, and then transverse go across. So they'll produce different types of actions. So they'll do compression of the abdomen. They'll assist in terms of coughing and stuff like that. They also do rotation of the abdomen, depending on whether you're doing one or the other or both. So different actions, different layers, and different fiber arrangements. Again, you can see that from the side in this figure. All right, now we're working our way to the limbs, and first we're starting with where those limbs will attach to the body. So we can see some of these, right? So we can see, for instance, the deltoid. We can see the pectoralis major converging like we saw. See a bit of this sternocleidomastoid. And the ones that you see on the patient's left-hand side here, pectoralis minor, as we mentioned, if there's a major, there's going to be a minor. Now don't worry, you don't have to worry about pectoralis minor. But if you look at it, right, you can see now it's relatively small compared to the big one we see on the right side there. Serratus anterior looks like a serrated knife, right, as it attaches to the rim like that, the ribs like that. And we can see so in the torso as well. Posterior, here's that trapezius. Remember, it's on both sides, not just one side. Ooh, my line went crazy there. Should be like this and over to here like that. Oh, man. And on the right side, we can see how it's pulled away. So we have latissimus dorsi, superficial. We have trapezius, and we have deltoid that we see here. And all of this that we see here is going to be our trapezius. So it forms a trapezoid. And you can imagine, right, the superior part of it is going to have a different effect from contracting the inferior part of it, just because where it's connected and where it spans. Deep to that, we see there's our rhomboides major right there. There's also a rhomboides or rhomboid minor. That's why we have a major and a minor. You don't have to know that one. And then we see those that are associated with the scapula: supraspinatus, infraspinatus. There's a teres minor that kind of blends in with it along here. And there's a subscapularis that's deep on the other side. And again, you can see how these, so here's our latissimus dorsi going across here. This little window that you see right here, this little pocket, this is also always called the triangle of auscultation. They do listening there, so if the doctor wants to listen to your lungs, he's going to put the stethoscope right there because there are very few layers of muscle right there. All you're getting is a little window of the rhomboideus major muscle. And again, we can see here some of the deeper muscles. There's that rhomboideus major. There's a little window that we were seeing right there. And you can see some associated with the scapula over on the right-hand side. All right, so with these ones that have an effect on the shoulder joint, again, remember, it all depends on what side of the limb it's attaching. It's on the posterior side, the anterior side, lateral side, medial side, etc. So we're going to find some that move that whole limb. We're going to find also there are these ones that are called the rotator cuff muscles that assist in keeping that head of the humerus attached to and close to that glenoid cavity. So those are supraspinatus, those ones that are associated with the spine and the scapula. Supraspinatus above the spine, infraspinatus below the spine, teres minor kind of blends with infraspinatus, and then subscapularis on the other side. They all help to keep that head of the humerus tight against the glenoid cavity. So take a look at this one. This is an interesting video that will show us the movement of the deltoid, and interestingly enough, how it can be, in some cases, its own antagonist.
The deltoid is the large fleshy muscle we most associate with the shoulder complex. It may be separated into three groups of fibers: anterior, middle, and posterior. The origin of the anterior fibers is from the lateral one-third of the clavicle. The insertion is to the deltoid tuberosity of the humerus. The anterior fibers move the arm forward from anatomical position, thus flexing the arm at the shoulder. They also medially rotate the arm by turning the anterior surface of the arm toward midline. They are innervated by the axillary nerve. The origin of the middle fibers is from the acromion of the scapula. The insertion is to the deltoid tuberosity of the humerus. The middle fibers abduct the arm. They are innervated by the axillary nerve. The origin of the posterior fibers is from the inferior border of the spine of the scapula.
And again, you can imagine, right? We saw there's an anterior portion, there's a posterior portion. What can you imagine is going to be the action of this one that we see here, right? So remember, we can do flexion of the arm. We can do extension of the arm. We saw a medial rotation from the anterior side. You can imagine with the fiber arrangement here, we can see a lateral rotation on the posterior side. So deltoid, for sure, because it connects all around that joint, you can contract different sections of that muscle and produce different actions, even those that are opposite to each other. Okay, so as we move from the shoulder joint, we start going towards the arm, we start to see additional muscles. So for instance, there's that biceps brachii, right? That everybody knows about. But deep to that is a muscle that's called brachialis that peeks out kind of on either side. So those are going to be acting, we'll find, on the shoulder joint. But we're also going to find, like biceps brachii, see where that tendon's going? It's going to end up going down, and it's going to be acting on the elbow joint as well. So it's going to be going right through there. It's going to be acting on that elbow joint. So let's take a look at some of these ones of the arm and then the forearm. So those are anterior. Now we're seeing posterior. And so posterior ones, we have triceps brachii. And a C, it's going to have 3 different heads to it. There's a long head and a short head and a lateral head. So 3 different origins as well. Here are some of those deep muscles that we saw, the rotator cuff muscles on the scapula. See how they're holding, attaching to that humerus, holding it in place. So some of these figures from your textbook do help you to isolate and analyze the attachments and the movements of these muscles. So for instance, biceps brachii, biceps 2 heads, brachii near the humerus, right? So 2 heads. So we have a long head along the lateral side, and we have a short head. See, this short head takes a straight shot up here to the coracoid process. Meanwhile, the long head has to go all the way around the head of the humerus, the long way, in order to attach up there at that supraglenoid tubercle. But when we look at the insertion, see how the insertion goes down here? The insertion goes beyond the elbow joint. So we actually get action at the shoulder joint, and we get action at the elbow joint. 2 joints affected. And then we see our triceps brachii as well, which is going to have that opposite action, right? So let's take a look here. See what we can do. Is that going to play for us? 1 second. I know you can't wait. It's an exciting movie coming out.
Biceps brachii is the large 2-headed flexor muscle located in the anterior compartment of the arm. The origin of the long head is from the supraglenoid tubercle of the scapula. The origin of the short head is from the tip of the coracoid process of the scapula. The 2 heads insert by a common tendon onto the radial tuberosity and by the bicipital aponeurosis, which blends with the deep fascia on the medial aspect of the forearm.
Yeah, you won't have to know that.
Biceps brachii flexes the forearm at the elbow supinates the forearm, and weakly flexes the shoulder. It is innervated by the musculocutaneous nerve.
So a few different actions for that one because of the angle which it connects and also the fact that it spans 2 joints.
The elbow joint is a hinge joint. Therefore, the muscles that act on this joint are limited to flexion and extension of the forearm at the humero-ulnar joint, while the forearm itself is capable of pronation and supination.
So I just wanted to remind us of those particular actions like we see there. Plus, you know, given the fact that sometimes it's around Halloween, it's a little creepy to see the skeleton moving that way. So we said we do get pronation and supination of the forearm as well. So we need to look at the muscles that can produce that too. And so when we look at it, we're looking at the anterior compartment here. What we can see is we're going to look at opposite fiber arrangements for those that are going to pronate the arm, the forearm, and supinate it. So on your list, you actually have one that's called pronator teres right here. And you can imagine that when it contracts, right, it's got an angle that goes across this way. When it contracts, it's going to be pulling it and kind of doing that unique rotation, bringing that thumb across like that. So we can see how it forms kind of a V with brachioradialis, right? Brachioradialis attaches to the humerus and the radius. That's where the name comes from. There's a deep muscle of that which is called the supinator as well, but it's kind of hard to see. So supinator, supinates, so you can hold a cup of soup. Pronator, pronator teres, is going to pronate. We also see a few of our wrist flexors here. Wrist flexors. Sorry, I was flexing my fingers. We'll see that some of these will even go down to the fingers, but you have to know flexor carpi radialis, flexor carpi ulnaris right here. So just look at where those tendons are going. We can see how they're going down by the radius or the ulna. That helps us to know their particular names. There's a middle one here you don't have to know. It's called palmaris longus. And you can see how it has loops of connective tissue that will go around each and every one of these fingers in order to flex them. So here's our deeper ones, and this one we can see our supinator, like I was mentioning, right? The pronator is going this way, supinator is going the other way. Here's our posterior that we see here. So 3 muscles we have to know here. These are all extensors, but we just follow the tendons down. Again, we can see how this one is associated with the ulna. And we're going to find that there is an extensor carpi radialis longus, where the tendon goes down here by the thumb. So that one helps to extend. And then there's one that goes right up in the middle here. You can see going to the digits, right? So that's extensor digitorum. Now when we go to the thigh, again, we're going to have flexion and extension. We're going to have abduction and adduction. So our adductors are going to be on the medial side. Our abductors are going to be on the lateral side instead. So adductors, you don't have to know all of these, but you do know some of them are just like adductor magnus. And then there's a few others in there too. Gracilis is on top of that. So adductor magnus is very, very wide, but it's deep, so it lies underneath some of these other ones. So you don't have to know, like I said, longus and brevis and things like that, but that's kind of where its name comes from. So adductors are going to be on the medial side. When we look on the anterior side, we find our quadriceps. That means 4, right? So we have vastus lateralis on the lateral side, vastus medialis on the medial side, vastus intermedius. This one is deep because usually we have rectus femoris right there in the middle on top of it. So that makes your 4. 3 vastus muscles, 1 rectus femoris, all coming down here, inserting on the patella, which then is connected via the patellar ligament to the tibia via the tibial tuberosity. So they're all inserting on this one ligament that we see down there. Posterior, we see our big butt muscle, gluteus maximus. You can see how there's a medius, there's also a minimus. You only have to know maximus. And we look at the hamstrings. So the hamstrings, once upon a time, they'd use big hooks like with ham, like with pigs. You know, you can imagine medieval times, times like that, they'd have butcher shops, and they would hang the meat in the window so you could see it. So they would actually take big hooks, and they would hook it right through these tendons like that, and hang it in the window. So that's why it's called hamstrings. So we're attaching to those tendons that we see here right behind the knee. The tendons of 3 muscles. Biceps femoris is on the lateral side, we see here. And then we have semitendinosus and semimembranosus on the medial side. Semitendinosus is on top, and semimembranosus is underneath. So as you can imagine, those are going to extend, right? They're going to extend the thigh. Quadriceps are going to flex the thigh. And we can see some of those here again, right? Biceps femoris on the lateral side, semitendinosus on top, semimembranosus kind of peeking out on either side. So let's take a look at that big butt muscle and see what it's doing, because notice that the fibers aren't quite straight there. So that's going to produce different types of actions. See if we can take a look.
The gluteus maximus is the large fleshy muscle that forms the bulk of the buttock. The origins of gluteus maximus are from the posterior ilium, sacrum, coccyx, and the sacrotuberous ligament. Some deep fibers insert onto the gluteal tuberosity of the femur. However, the majority of the fibers insert onto the iliotibial tract of the fascia lata. The gluteus maximus is the most powerful extensor of the thigh at the hip. It also assists in lateral rotation of the thigh. It is innervated by the inferior gluteal nerve.
So you can see with that angle of the fibers, not only are we getting, like we saw extension, but you're getting some lateral rotation. And we can see some of our deep hip muscles. A lot of times when people are working out or whatever, or running, they'll talk about some of these, piriformes. I got a problem with that, piriformis syndrome. About a year or so ago, I actually blew it out. I had pulled it, running a short distance race, running it too fast, and then I went and did a half marathon where it was still healing. And I was running along, and it was getting tense, and it was getting more tense and more tense. About mile 8 or so, it just went pow, and I kind of pulled over the side like a car getting a flat tire, and felt that kind of weakness to it. And because these are a lot of hip stabilizers, but slow as you go, still kept my head down, slowed my pace, and just finished the race. But never quite been the same. Anyways, small testimonial there. You don't have to know piriformes. Okay, when we get down to the leg as well, we're going to start seeing some of those additional flexors and extensors. So we had quadriceps on the anterior side, we had hamstrings on the posterior side. And now when we get down to the leg, we're going to have, instead of extension and flexion, what we have is dorsiflexion, where the toes come up, and then plantar flexion, where the toes go down. So it looks a little bit more like this. So it's a little bit like supination and pronation.
And dorsiflexion and plantar flexion of the ankle joint. The various muscles of the leg that act on the ankle and foot are found within 3 compartments: the anterior compartment, the lateral compartment, and the posterior compartment.
It's kind of interesting when you think about and you feel, you palpate your leg, right? You don't feel a lot on the medial aspect, right? You feel your tibia there, your shin. Feel a lot on the lateral side where your fibula is embedded. Feel a lot, some on the anterior side where your tibialis anterior is, and a lot on the posterior side as well. So again, when we're looking at them, on the anterior side, through here, our main one is going to be our tibialis anterior. And where it's connecting, it's going to bring the toes up, right? It's only going to shorten. So it's going to bring the toes up. That means it's going to be dorsiflecting. We also have the lateral compartment, right? Lateral compartment, we don't have to know a lot of these. They used to be called a different name. Now they're called fibularis because they're associated with the fibula. But we move to the posterior compartment as well. And when we look at the posterior compartment, we have some prominent muscles there, the gastrocnemius, which is most superficial, 2 heads to it, and then deep to that we have the soleus. Again, reminiscent of the biceps brachii, and then deeper to that, the brachialis, right? And they're working together to produce a particular action. Same thing here. So what we have here, we'll see in the video.
Soleus is located in the posterior compartment of the leg, deep to gastrocnemius. The origins of soleus are from the proximal 1/3 of the posterior fibula and the soleal line of the posterior tibia. Soleus passes inferiorly and merges with the deep layer of the calcaneal tendon, which inserts onto the posterior calcaneus. Soleus plantar flexes the foot at the ankle. It is innervated by the tibial nerve.
So there you go. Again, you can see where it connects according to that joint and how it's going to produce, in this case, that plantar flexion. Now these figures are just kind of a couple of review figures at the end where we look at these different compartments and how the muscles in different sides of the limb can produce different actions. So for instance, on the anterior side, we're going to have that wrist flexion, right? On the posterior side, right, we're going to see that extension. And then on the medial side, we're going to see that adduction, adding it to the center mass. And if you really look at it, it looks like a slice of ham. Oh, right? When you have a big ham like that, that's what we're looking at. So when you see that big ham bone to it, next time you're taking a look at it, like at Easter or something like that, start trying to see some of these compartments of the thigh and of the muscle groups. You can gross out your neighbors and your family. Same thing when we get down here. I like along the left-hand side here. Perfect for Halloween. We see a cut leg like that. But again, we see a lot in the posterior, right? We see some on the lateral, a little bit on the anterior, not a lot on the medial side there, right, where the tibia is. But that takes us through a longer, but still a tour of the skeletal muscle system and the different muscles involved, most of them, and just remind you about how they work, how they are named, how they produce their movements according to these lever systems, etc. So don't forget to use those tables and figures within the chapter to help you learn all the different muscles you need to for lab. But these are the topics that we have associated with the chapter for lecture. The next time we move into another excitable type of cell, we're going to be moving into the neurons and the nerve cells instead. So that's about it for now. Thanks for sitting through it, and we will see you in the nervous system coming up.